medical terminology training for your front desk team, brought to you by Healthcare Training Leader. Your presenter today is the amazing Tracy Bird from Medical Practice Advisors, a true expert in medical office operations and staff development. Whether your front desk team is brand new or needs a refresher, this training gives them the essential tools to understand and confidently use medical terminology every day. Why is it so important? Because your front desk is the first point of contact with your patients, and first impressions matter. Have a question during the webinar? Type it into the comments. We're here live answering as many of your questions as we can. Also, here's a little insider tip. Comment medical terminology at any time during the webinar, and we'll send you an exclusive discount on any Healthcare Training Leader product or service. That's right. From healthcare compliance to revenue cycle management, billing, coding, front desk operations, and staff training, we've got the tools you need to succeed. And don't forget to subscribe to the Healthcare Training Leader YouTube channel. That way, you'll never miss out on our latest in healthcare front desk training strategies. And exclusively just for those of you on this live stream event, we have a free script for your front desk team. This fantastic tool reviews common scenarios that your front desk will face. Perfect tool for any front desk staff member. Drop a comment below and we'll get it to you. Let's get started with medical terminology training for your front desk team with Tracy Bird. Improve communication, reduce costly errors, and create a confident, informed front desk team right now. We're so glad that you're here. Let's go ahead and dive in. Welcome, Tracy.
So what we're going to go over today is reviewing some of those skills to be an effective reception staff or PSRs or whatever your title is at that front desk position. Reviewing an introduction to human anatomy. So, at the time, I had not had any introduction to anatomy or physiology. And then reviewing the introduction to medical terminology. The study of terms used in the art and science of medicine is what medical terminology is. It is the universal language of medicine. Our doctors are taught that, our nurses are taught that in all of their training, but we're kind of facilitating all of that work, all that clinical work behind the scenes. So we need to have, a good baseline knowledge of some of that terminology. So it is the functional language that healthcare workers communicate with. Our doctors and nurses, you probably hear that language all the time in the office. So medical terminology really is part of your world. Now, the qualities that we look for in best practices for our reception staff are effective communication, professionalism, those interpersonal relationship skills, and I'm going to talk a little bit about that as we go through here. And being able to multitask, your organization skills, and then part of really knowing or understanding some of the medical terminology is included in your technical acumen for the position. So why do we even need to know about anatomy and medical terminology? Being informed as a professional that you are at the front is really important. Patients are going to ask you questions. You need to have some level of, ability to answer this question, gaining a working knowledge so you can do the duty that you're expected to do in the medical setting. And then being able to explain and inform patients. For example, if they're going to have a CT scan with contrast, then they say, what does that mean? And being able to explain how they're going to feel and what they can expect is important. The ability to recognize and learn new terms when you encounter them in the future. Where do you go to find out what something means So basic anatomy are the body parts, structures, and organ systems. We have all of these that you see on the screen. So we'll run through each of these separately. Integumentary is the skin. It's hair, nails, sweat glands, mammary glands. All of these work together to protect the body and disease. And it's the largest organ system in the body. Regulates our temperature, eliminates waste, provides sensation. So skin, if you work in dermatology, you're probably really aware of some of these, and maybe even in primary care. You hear a lot of these. Dermis, epidermis, hair follicles, adipose tissue, those are fat cells, those kinds of things. Musculoskeletal system are the bones, joints, and ligaments and tendons that hold all of our bones together. This system allows movement and supports and protects all of our vital organs. The respiratory system is includes the nose, the nasal cavity, our pharynx, our larynx, trachea, bronchi, and our lungs. And the system itself supplies the body with oxygen, which is delivered to all other parts of the body. The cardiovascular system. This is our heart, our arteries, our veins that run through the body. It distributes the oxygen throughout our bodies. It removes waste products and provides temperature control. The lymph system includes our lymph nodes, ducts, tissues, transports lymph fluid through our entire circulatory system. And this is a major component of the immune system. Digestive, that starts at our mouth and runs through the body, clear through to the anus. This is where the system that where we're eating, we're digesting, and eliminating food. So, all of the esophagus, tongue, mouth, all of our, we're ingesting food, the liver, the gallbladder, and all the areas of the intestine that take the food and digest it for us and so forth. The urinary system, that includes the kidneys, the ureters, the bladder, and the urethra. These organs work together to filter and remove waste. They also controls the amount of salt and water in our bodies. We have the male reproductive system. Obviously, we need the male reproductive system for procreation, but it does include the bladder, urethra, testes, glands, all of those areas of the male anatomy. And likewise, we have the female reproductive system, again, for procreation. The ovaries, the fallopian tubes, the uterine cavity, ovaries, so on and so forth. Then we have the nervous system. So actually, there are two basic parts to the nervous system. It includes the brain, spines, nerves, and neurons. And when they all work together, they coordinate activity of the muscles, they monitor our organs, and they send input into the senses that initiate particular actions. So when you look at that, it's like, my goodness, we have quite a network of nerves and neurons firing off in our bodies, don't we? Then the ear, nose, and throat system, it includes all three of those. The nose, obviously, is our sensory organ for smell. Mouth is the opening that allows food to travel through the esophagus and the digestive system. But ears, ear, nose, and throat, sinuses are all part of this. Our auditory system, this is one of the sensory organ systems. Lots of little minute areas in the hearing, internal canals, external canal, and then all the malleus, the incus, all of these little, the stapes, all of this. I worked in an ENT practice for about 8 years, so became very familiar with, the cochlear nerve, all of this, eustachian tube, all of the anatomy of the ear, nose, and throat, actually. The ocular system, this is the second of the sensory organ systems. The ocular obviously allows us to see. It includes the eyelids and the tear ducts. So this is, if you've been to the eye doctor and had a eye exam, you know that they're looking at all these areas, our cornea, our iris, they're looking at our optic nerve, the retina. The immune system, this is made up of all the molecular and genetic components that defend our body against any external or foreign organism. The system creates antibodies and releases them into the bloodstream to help us fight off diseases. So the immune system is it's an important one for sure. Okay, let's move on and talk about medical terminology in a little bit more detail. So the root of the medical terms is either Greek or Latin. And the two major categories of medical terms are descriptive. So those are words that are used to describe illnesses, diseases, medical conditions, the shape, size, color, function. It is what it says it is. There are descriptive types of terms. An eponym, on the other hand, is a disease named after a person who discovered it. So we'll talk about a few of those as we go through. So when we break down a medical term, typically they have 3 parts. There's usually a prefix, which can be just a letter or can be several letters that are at the beginning of the root word. They're tacked on, if you will, to the root word that will either change or add to the meaning of that root word. It could also indicate a place, time, or number. So the root, or the middle or the primary section of a medical term, stands alone as the main part of the term. And it holds a fundamental meaning to the phrase. The suffix then is added to the end of the word, and it simply modifies the meaning. So it can also indicate a procedure, a condition, a disease, or a disorder. So you'll see in a little bit how these go together. Now, some of the common prefixes are numbers. So the prefix might be mono or uni, which means one. So the example is unilateral. So uni is the prefix, and lateral is the root word. Bi means two, so biceps. We have two of those. Tri is three. The example is triplicate. Quadra is four, so quadriceps. Or hex or sex means six, so hexos. And diplo means double. So you can see that these prefixes, really are integral to the words and really give it meaning. So just knowing what some of these prefixes are, helps you understand what the root is. Melon or melano, like as in melanoma, that's black. We know that those skin cancers that are melanoma are often characterized by the color of that lesion. Cyan or cyano is the color blue. So we know that cyanosis means someone's not getting enough oxygen and they look blue. Xantho is yellow. So a xanthoma is, that's a skin disorder causing something to look yellow. Now there are also prefixes that are directional, and these are very helpful to understand the root word. So endo means within or inside of, and the example is an endoscopy. So for example, if somebody is going to go for a colonoscopy or any kind of an endoscopic procedure, that means that we're going to go inside to take a look. Peri means around. So perianal means around the anus. Circum is around. Circumcision is an example of it's around the head of the penis. Retro is behind. So retrosternal means behind the sternum. Epi is upon or on top of. Epidermis, that's the outer layer of skin. So you can see that these directional terms help define or give meaning to maybe a term that you don't know quite as well. Trans is through, transurethral, so through the urethra. Intra is within or intravenous. So we do an injection intravenous, or we place an IV intravenously. Sub is below, or subclavian is an example of that. Some other common prefixes, just ab means away from, ad means toward. So those are good things so abduction or adduction, knowing the difference between AB and AD, either away from or toward, definitely changes the meaning of the word. Ecto is outside. Endo is inside. So meaning the directions on those, inside and outside, are important. Epi is upon, so epinephrine, or infrared is below or under. Ipsilateral is the same. Meso is in the middle. Meta, after, beyond, or transforming. So metastasize. We know in cancer cells that means that they are expanding or transforming, multiplying, if you will. Peri, surrounding. Retro is behind or back. Sub is below, so submandibular, under the mandible. Trans is across or through, so we are transcutaneous. So just learning those prefixes really does help to understand the true, the full meaning of the word. Some anatomical positions and planes are anterior, so that's toward the front of the body. Deep is closer to the center of the body. Distal is the furthest end of the point of attachment. So they might say it's the distal end of the whatever. So you know that that's the furthest. That means the furthest point. Lateral means toward the inside. Posterior is toward the back. Superficial is close to the skin. So that's a superficial abrasion. For example, a skin knee. And then we have the 5 different types of membranes in the body. Mucous membranes are the membranes that line the interior walls and tubes that open to the outside. So they can be found in the digestive system, the respiratory, urinary, reproductive systems. So all those mucous membranes are where we have open orifices, I guess you could say, in our bodies. The serous membranes line the cavities inside the body as well as internal organs. So they kind of protect the inside of the body. The synovial membranes are those that surround our joints and lubricate the joints so the bones move freely. Meninges are made up of 3 connective tissue membranes that are really protect the spinal cord and the brain. Just those connective tissues alone are important to protect those critical areas of our bodies. Cutaneous membranes are those, the membrane is the skin, and it is the largest body covering it's the largest body area. Now, some of our root words, and depending on what specialty you all are working in, if you're in primary care, you're likely to hear a lot of these. If you are, in a specialty, for example, GI, you're going to hear gastro a lot. If you're in derm, you're going to hear derm a lot. If you, rhino, you're going to probably be in ENT. So you'll see a lot of these are common, maybe to you, because you work in that particular field, or they may be brand new to you. So cepho or cephalo is meaning the head. Chrome is the color. Enter, derm, gastro, you can read all of these. Myo or myelo, spinal cord. Myo is muscle. Myofascial, that's that inside the muscle. Onc or onco is the nail. So maybe in derm or primary care, somebody has onychomycosis. If you work in ortho, you're going to see the word osteo a lot. Osteoarthritis, osteomyelitis. So, bone. Osteo is bone. Pulmo If you work in pulmonology, you will see that a lot. Pulmo is our lungs. And then thrombo or thromb, cardiology perhaps has a lot of that. We have a lot of, vessels and ducts and blood that has to run through there. So common suffixes then are that ending of the word, and these are really good to know as well. Algia means pain, so cervicalgia means neck pain. For example, a or an is without or none, so anemia. We all know what that is. Desis, binding or fusing. So arthrodesis is a procedure that that orthopods or spine surgeons will do. Fusing, our spinal, some of the joints in the spinal cord. Centesis is puncture or tap. Emia, blood. Anemia, example. Graphy is the act of recording data. So radiography, for example, is an x-ray. Pexy is a surgical fixation. Plasty is repair. Oscopy is looking at. So, you've seen words like retinopathy, colonoscopy, dermoplasty. You've seen those, but maybe didn't know that the pieces by themselves really add to the meaning of the word. Some other common suffixes is itis, which means inflammation. You have sinusitis, you have arthritis, any itis is inflammation. Ectomy means surgical removal. So the example is hysterectomy. Prostatectomy, any procedure that is removal of something is ectomy. Otomy, on the other hand, is going in and looking. So the difference between removing it and just going in to look at it, which these are often done endoscopically, going in and looking. Ostomy is creating an opening. So otomy is viewing, ostomy is creating an opening. Probably you're all familiar with the term colostomy. So that is, an opening to allow the waste to be removed through a colostomy. Raja means flow. Raphi means surgical suturing. So if you work in OBGYN, for example, you might see the words menorrhagia or colporaphy used often. Wonder what they mean. Well, a colporaphy is surgical suturing of something. So as we put all of these together, the rules for combining the word parts into a word. So when, this is pretty technical, but interesting, I think. So when a prefix ends in a vowel and the suffix begins with a vowel, you drop one, and when you're combining the two parts of the word. So by understanding the root word, the prefixes and the suffixes, then you can really piece together the meaning of the entire term. So, for example, rhino, as we learned, means nose. Plasty is plastic repair. So a rhinoplasty is plastic repair of the nose. That's plastic surgery to correct the appearance of someone's nose. For example, cardio means heart. Myo, if you remember, means muscle. Pathy means the word disease. So cardiomyopathy is a diseased heart muscle. So some of the common terms we have in the skin area: dermis, epidermis, keratin, melanin, and cutane. All of these are here. Dermis is the inner layer of the skin. Epi, remember, means out, so outer layer of the skin. Keratin is a horny or cornified layer of the skin. So we have a keratinic lesion, for example. Melanin is the color. Remember, mellow black, so melanoma. And cutane, skin or subcutaneous cyst, for example. So just having a working knowledge of what the prefixes and suffixes mean, as well as, a good understanding of the root words, helps you put all of those together and understand some of that medical terminology that gets kind of thrown around in your offices. Osteo, as we learned, means bone. So osteoitis, remember, itis meant inflammation. So osteoitis is inflammation of the bone. Chondro, arthro, teno, all of these will be terms that you might hear if you are in the musculoskeletal area, or a lot of times in primary care as well. They treat arthritis, costochondritis, bursitis, many of these. Respiratory, rhino, as we learned, means nose. So rhinitis or rhinorrhea are examples. Laryngitis, trachea, tracheotomy, tracheostomy. Remember the ostomy. Broncho, pneumo, pulmo, all of those in the respiratory. The reconstruction, plasty. So a rhinoplasty is reconstruction of the nose. In the cardiovascular area, same thing. Cardio-brady or tachy. You've heard the terms bradycardia or tachycardia. So bradycardia is slow heart rate. Tachycardia is fast heart rate. So if you work in cardiology, those terms are used a lot. Angiogram. Veno is vein. Stasis means to stop. So hemostasis, we want to stop bleeding, for example. Cyto means, or cyta means cell. So we have erythrocytes, leukocytes. If you're looking at a lab report or somebody's asking you a question about, I don't understand what this lab report means, I would not expect someone from the front desk to have that conversation with a patient. But you can say, let me get the nurse and she can explain that to you. But you might understand that it is red and white blood cells, for example, if it talks about erythrocytes or leukocytes, because you know that leuko means white. Lymph. In the lymph system, we have all of these terms: chromo, cyto, immuno, but lymph itself, lymphadenitis, lymphedema is swelling of the lymph areas. Morphology. Thrombo means clot. So a thrombosis. In the digestive system, If you work in GI, you hear these all the time. Gaster or gastro means the stomach. Gastritis or gastrectomy, or gastroenteritis. Those are all terms that you probably hear. Hepato has to do with the liver. Hepatitis, we've all heard of that. That is part of the liver was part of the digestive system. So, GI doctors take care of the liver and liver conditions as well. Cholecystitis, cholecystectomy, that has to do with our gallbladder. Cysto for the bladder. Emesis, vomiting, for example. Trypsy, lithotripsy, or to crush. Cholelithotripsy. We're getting rid of a gallstone in that scenario. Rheosis. So all of those terms sort of are inherent in a lot of the digestive areas. You're in the urinary system. We have nephra or nephro, which relates directly to kidney. So we have nephritis. As an example, hydro means water. Hydronephrosis means a backup of urine into the kidney. Cysto, pyelo, all of these, olig or oleo, pexy, all of these are really common terms in the urinary system. And then very common terms in the reproductive and male systems. Orchid or orchio means the testes. Prostate, prosta or prosto. Vas or vaso. Raphe. Hister, salpingitis is the fallopian tube, of inflammation of the fallopian tube. Oophorio means ovary, so an oophorectomy would be removal of the ovaries. Gravida means pregnancy, so prima gravida means first pregnancy. Those kinds of things. So if you're in OBGYN or work in urology or with male health, you'll see some of these. In ear, nose, and throat, we have hypo-blephara. You might have heard of a procedure called blepharoplasty. That's where we take the extra skin that hangs down over the eyelid that sometimes inhibits people's vision and, cut that away and remove it. Cornea, glyco, you may have heard of glaucoma. The glyco means gray, so that's causes that, people not to be able to see. Presbycusis, old age hearing loss. Sclera, white part of the eye. And in the immune system area, knowing, aden or adeno, anti, edem, gram, oma, tumor or mass. Hematoma is an example there. Megaly means large. Cardiomegaly, enlarged heart. Ologist, one who studies. So we have any ologist. I call them the ologist. If somebody calls in a consult for an ologist, neurologist, pathologist, gynecologist, cardiologist, all of our specialists, one who studies. Nervous system. Cephalo means head. Encephalo, inside the brain. Meningio. So if you work with a neurosurgeon or a neurologist, you may hear some of these terms. Myelo, neuro is nerve, a neuroma. Plesia, those kinds of terms. In summary, I would say really being informed and able to communicate. There will be a lot of questions that you will receive that you won't be able to answer, and that you will need to get a nurse or the doctor to answer. But, we really want you to have a baseline knowledge to at least understand what the terms mean in your particular specialty. And you can, honestly, if you Google how to pronounce a particular word and you put it in Google, there's a little microphone. You can listen to the correct pronunciation of some of these medical terms. They can be pretty difficult to learn to say. But, Google can be your friend. So, use some of that. If you're not sure how to say something, Google how to pronounce it. I think just being able to speak the language intelligently with patients and having a baseline understanding of the words and what they mean. Now if somebody asks you to get technical about what's going to happen to me, that's out of your purview. We don't expect you to have that conversation to tell the patient what they can expect. That really is a clinical responsibility. But just being able to understand what the words mean and have an intelligent conversation with someone, I think shows what it does is it instills trust in the patient's view. When they see you doing your job competently and that you can speak the language competently, that builds a level of trust with patients. They have what we call a moment of truth. And that moment of truth is when a patient feels like they are actually in a safe place that cares about them to receive their care. And part of that is being able to speak the language, if you will. So just remember that, Greek and Latin are really what the root words make up for our body parts and our organ systems. Try to remember, sometimes it helps to remember or to have an image of each term. That's kind of a cue for you. There are some great apps that you can get on your computer or your phone that can help you with some of that. Lots of online resources. I don't know whether your practice has, maybe they would send you to an anatomy and medical terminology course. But I think just understanding in your particular specialty, what the words are and what they mean is going to be extremely important.
Thank you, Tracy, and thank you all so much for joining us today. Empowering your front desk team with the right terminology is one of the smartest moves you can make for your practice. Keep learning, keep growing, and remember, we're here to support you every step of the way. Smash that like button if you learned something new today. Comment medical terminology for your discount, and hit that subscribe button so you're always in the loop with Healthcare Training Leader. And exclusively, just for those of you on this live stream event, we have a free script for your front desk team. This fantastic tool reviews common scenarios that your front desk will face. perfect tool for any front desk staff member. Drop a comment now and we'll get it to you. And until next time, keep up the amazing work.